Hello, my name is Jessica Chavez and my topic is glaucoma. What is glaucoma? Glaucoma is a group of eye diseases that produce increased intraocular pressure caused by backup fluid in the eye. When the eye pressure is increased, the optic nerve becomes damaged and the retinal ganglia cell undergo a slow process of cell death that results in permanent vision loss. I've listed the major categories of glaucoma. Open angle and primary angle closure are the two most common conditions. The picture on the right shows the narrowing of the optic field. This is what a person who is losing sight due to glaucoma would see. Prevalence in USA. Glaucoma is the second most common cause of blindness in the United States and the single most important cause of blindness among African Americans. Although approximately 3 million Americans have glaucoma, only 1 million are aware that they have the disease. This is because most forms of glaucoma do not show symptoms in the early stages and thus patients go untreated. The images on the right are of a bar and pie chart from 2010 comparing rates for glaucoma by age, race, and gender. Normal versus glaucoma. On the left, the picture depicts a normal human eye. The human eye is filled with liquid that is made continuously and is drained away. You can see the site of production and how the drainage canal is working properly. On the right, the picture demonstrates a patient with glaucoma. When someone has glaucoma, the opening where the liquid is drained is closed. This causes the liquid to build up and increases pressure inside the eye. This can damage the eye, reduce vision, and become blind. Some risk factors. As I mentioned previously, age and race are a risk factor. However, I've listed other risk factors that can contribute to the cause of glaucoma. Signs and symptoms. Open angle glaucoma, one of the most common conditions, doesn't usually cause any symptoms to begin with. That is why eye screenings are so important for early detection. The condition tends to develop slowly and affects the edges of the peripheral vision. Some overall signs and symptoms for most types of glaucoma are gradual loss of peripheral vision, sensitivity to light, and severe eye aches. Important facts. If there is anything you take away from this presentation, let it be this. Damage to your vision caused by glaucoma cannot be restored. But the good news is early detection and treatment can prevent severe vision loss in the future. As I mentioned before, most types of glaucoma are asymptomatic. This disease progresses and causes significant damage. That is why screening is so critical. Now that we know the importance of screening, here are a few ways to screen for glaucoma. Visual acuity test. This test measures distance using a chart with letters. Visual field test. This test measures your peripheral vision. Dilated eye exam. This test dilates the pupils, which allows your doctor to check the optic nerve and retina for damage. Tonometry. This measures the fluid pressure in the eye. Pyometry. This is a measure of your cornea's thickness using the ultrasonic wave instrument. Once you've been diagnosed, the most common treatments are eye drops, laser, and/or surgery. Eye drops are the standard medication option for glaucoma patients. Laser is used to open drainage channels in the eye. Surgery is used to either open the natural drainage channels in the eye, to insert tiny shunts to improve drainage, or to remove the part of the eye that has prevented fluid drainage. This is an illustration guide to educate patients with glaucoma. The author of this illustration said, to imagine your eye like a water tank. Water flows in, water flows out. If the outlet is blocked, water cannot flow out, and the water tank will burst. To correct this, you must fix the outlet or put in a new outlet. And these are my references. Thank you so much for your time.